Welcome to the Heart of Health and Science. Today we're talking about the importance of healthcare equity and disparity that is experienced among healthcare providers and those who come to receive healthcare. Have the opportunity to talk to two what I consider to be experts in this field. One is Thomas Murphy, who is the Vice President of Human Resources at Liberty Hospital, and Lindsay James, who is our Director of Quality and Healthcare Equity Officer. So I want to welcome both of you here to the podcast today. So Thomas, I'd like to start with you and ask you how healthcare equity differs from equality as people see it or understand it or know it to be.
It's a great question. And Lindsay will probably be able to weigh in on this as well, specifically from the purpose or from the perspective of health equity and healthcare equity. They are two different concepts, and equity is all about how do we make sure that we're treating people in a fair and consistent manner, and that we have policies and practices in place that enable everybody to be successful in a consistent way. And that's where, my role in workforce development and human resources really comes in. Health equity is more about recognizing and efforting changes to improve disparities in healthcare among those different populations of our patients in our community.
Mm-hmm. As you were talking, I'm reminded of when I first started out in nursing. One of the things that an instructor taught me was that you really need to take care of patients whose values and beliefs align with your own. That way you can provide the best care possible for them. I was formally taught that. And over the course of time, I realized, actually it started pretty quickly, that it doesn't matter what the belief system or the value system of the patients that I'm serving, what those are. What matters is that I'm providing unbiased, non-judgmental care to each person as an individual and the care that they need. It is not our place to judge people for any decisions or life choices that are made. It is our place to provide care and to provide that to the best of our ability. Everybody across the board, no matter what. And I think over the course of time, I hope at least that the mantra around diversity and around different values that people hold dear has changed, so that we treat people very, very across the board, non-judgmentally, and with high quality and honor. That's what we're here to do. So, Lindsay, I want to come back over to you and ask you about healthcare equity just across the board. I don't think that topic really comes up in dinner conversations, or that vernacular actually comes up in conversation. So if you could break that down so that maybe we can move forward and introduce that into conversations around the lunch table or the dinner table or the water cooler even, so that people can understand really what is being discussed with that topic.
Funny you asked that. Actually, when I have someone ask what my job title is and I say health equity officer, they're like, what is that? So I think you're right. I think there is a lot of people that aren't quite sure what that means or where we get that term. But in simplistic terms, it is having a seat at the table and making sure that everyone has a seat there, giving people the same opportunity as everybody else, regardless of their gender, their class, their economic status, race, ethnicity, age, that everyone has a seat there and that we all can reach that health level of health that we want in our lives. We're all on different spectrums. You have extremely active and healthy young individuals. You have chronic illness individuals. You have the aging adult populations. But everyone has a version of what is their best health, what is their best quality of life, and making sure that we all have that opportunity, and then filling in those gaps when that opportunity can't be reached. So making sure that we find those community resources or resources within the hospital to help those gaps be filled.
To continue on with that, what kind of things have you been seeing in the Northland specifically that maybe we could do a better job in reaching people or a better job in bringing people together?
So we are very early in a lot of our data collection efforts. We've been collecting data for about a little over a year. And some of the historical data we have is not the most accurate because this wasn't a huge focus many years ago. So really, this is something that we've really started to really key in on in the last probably 12 to 24 months. And from that data, we are finding that our Medicaid populations, our underinsured and our uninsured populations, specifically to chronic illness, readmit more than any other population that we have. So what that means is that for some reason there's some kind of barrier for those patients. There's some kind of disparity. Is it insurance coverage and the ability to get specialty care? Is it a medication expense? Is it a life issue like transportation or work related? I can't make it to my appointments. Locations are sometimes an issue. We have patients that come from very rural areas. We have metropolitan patients. Are our rural patients unable to get back into the city to see those specialty doctors? So we're digging into those different cases to see what data can we pull from that, and how can we bridge some of those gaps for those patients.
So when you see that type of disparity that you've described, what kind of outcomes do those patients have when they have those issues, whether they're underinsured, uninsured, they can't get to a place because of transportation issues? Do you see a difference in the outcomes that they have as far as their health goes?
Certainly. We know that when patients with chronic illness, such as heart failure or pneumonia or diabetes, even if they're not able to stick with their medical regimen, see their follow up specialists, see their primary care doctors when they're supposed to, that illness is only going to become more chronic. And so the management of that becomes very difficult. And then their quality of life becomes less. And then they're in the hospital more. And we all know that the more you're in the hospital, that's not where we want everyone to be. I mean, we're glad you're visiting us, but we would like to see you leave.
And get back into your life.
Yes, we want you to live a very healthy life outside of the hospital. So the readmissions, I mean, I think that's an area that you can see that, if someone is readmitting within 30 days of being in the hospital, there's a problem. How can we help prevent that? How can we keep them at home and in their daily life, living life? How do we help them? How do we support them while they're in the hospital? Chronic illness is hard. So, realigning and trying to figure out how to support those patients may look a little different than someone who's just there for an outpatient surgery,
Mhm.
So I think that's something we can do better in healthcare. And that's part of health equity.
It is. One of the things that, you keep making things just pop into my mind. Several years ago, I had a chronic illness that I had been dealing with for 10 plus years. And there was an ultimate solution for that, but I was really resistant to that ultimate solution. And as a result of my resistance to that, every 18 months to 2 years, I had to go into the hospital and have a surgery done. And I had 9 of those done, just because I was resisting that ultimate outcome. And one day when I went back in for the surgery again, um, one of the nurses who was doing the pre-admission and all of that, she came in and said, "Oh, you're back again?" And I was just so what I call fragile at that point because this was an everyday thing for me, every moment of every day. When she said that, she meant nothing by that other than, "Oh, I wish you could get better." I know that's what she was thinking, but what I heard was judgmental, attitude. What I heard was, this negativity and this judgment coming at me of, "Why are you back? Why are you back? Why are you back?" And, once I was able to process through that and get my emotion out of the way, I was able to, uh, get to the intent of what she was saying, which brings me to, really being hyper aware of the things that I say, especially to our patients, the things that I say, because our words as the healthcare experts, they carry a lot of weight and they carry a lot of, they just matter. They just matter. And if we could just get to the point where we can take any judgmental comments, any sarcastic comments, which I'm very known for, if we could take all of that just out of the conversation during those crisis times for patients, then I think we could go much further, much quicker. Which brings me back over to you, Tom. Uh, when you say that we're trying to work with our staff and make sure that they receive the same across the board treatment fair treatment across the board. What kind of things do you see that we do now that maybe we weren't doing previously, or the things that we're doing differently than maybe other people are doing?
Well, I think there's probably a lot to that. There are certainly some of like the more standard tactile things. One thing that comes to mind is pay equity and how important that is. And we've really worked as a leadership team, HR and the leadership teams together to make sure that we're paying all of our employees consistently with
Yes.
their pay band and based on their years of experience. I know that's something that you and I have even worked together on, Regina, with the nursing team to make sure that we're doing the right thing for all of our people in the workforce. The other thing that you've really helped us kind of spearhead and lead that helps with all of this work is just focusing on our culture, which ties back to our people first. And so that piece is just so important. We've spent a lot of time with our leaders over the last year, helping them get comfortable with not only being vulnerable and focusing on safety and culture efforts, but then also being able to bring that to their teams and help them feel comfortable in their work environment, coming to work and taking care of patients every day. And you mentioned bias earlier, and that's something that we can always tie back to, and that's something that we've launched training on for all of our employees over the last several years. We actually re-educate on it every year because it's so important because it helps take out that stigma and it helps us put ourselves in the patient's shoes, or as leaders put ourselves in our team members' shoes. What are they feeling? And when we know, or when we can think about how they're feeling about a situation or what they're thinking right now, it helps us react in a better way that's more aligned with what they need from us right now.
I know that you were very instrumental in bringing in a speaker to talk about implicit bias. And I know that you were not prepared for me to talk about this at all. But would you mind talking a little bit about that? I learned so much from that training. I think that I am among the most non-judgmental people. Of course, I would think that, right? That can be. But during that training, I realized that I have some bias in me, and when I first look at a situation, that I can look through those eyes of whether it's a biased set of eyes or a judgmental set of eyes, that I was actually shocked by. So can you talk just a little bit about what we learned in that training?
Yeah. That's been a couple of years ago that we brought that to the senior leadership team, and then we ended up bringing it back for physicians. So that was kind of an add-on from a bias workshop or a bias training that we did for all employees. Then we brought that workshop for the senior leadership team. They focused on health equity too, which was really cool. But that really, I think, taught us all. It was kind of an eye opener, and I think it started with, if I'm remembering right, a kind of a self test or a self assessment to see, do you have bias? And of course, you
Of
all go
course
into that
not.
thinking, no, that I don't have
No.
that. Everyone does, and I think that's the foundational knowledge to know about bias is that everybody has it. If you think you don't, you do, and just knowing that then enables you to think through that differently. And it's okay to have bias. We're all like that's humans, and we have it because we are born and raised into a certain environment that's different from every other human's environment that they've ever or that they've grown up in, and that forms our thoughts. That's how we develop as humans. So that that bias workshop was really eye-opening, and I think it helped our senior team relate to each other better. It helps our physicians relate to each other and then relate to patients better.
Yeah, I would agree with all of that. All of that. I grew up in West Virginia, and very tight-knit community, very, common belief system, in that community, and, I may have been called a redneck here and there myself. I've been called that, but I'm from West Virginia, and I'm okay with that. But when I then married my husband, he was active duty military, and we went from this tight-knit community of West Virginia in West Virginia to, a state in the Northeast, the Northwest, the state in the Northwest. And it was nothing like it was at home, nothing. And, the things that I grew up believing and just it was just part of me. I learned within a month that I was all kinds of wrong, and I needed to start relearning some things. And then as we move from place to place, I was amazed at how culturally different places in the country are. And, boy, I learned so much. I think that really helped me actually, to really pull myself out of an equation because not one person is right about every situation or even any situation. We have to bring in other opinions and other viewpoints and hearts and feelings into everything that we do, especially in healthcare, especially. So, Lindsay, I know that you have formed a team, the health equity team, and you're doing a lot of work out in the community. Can you talk a little bit about that community work that you're doing and that you're spearheading?
Yeah, so we have done quite a few things here recently that we've kind of launched. They've been hard at work for the last year to get these in place, but we recently did our first mobile food pantry, and we partnered with Harvesters and Redemptress, a non-for-profit here in Kansas City. And we are now doing a mobile food pantry that is hosted by our location once a month for the entire community. Our first one ever, we served over 164 families.
Wow, I
That
love
was
that.
amazing. And we had people from 7 different counties.
Wow.
So it's not just Clay County. We are servicing people in our area counties as well. And it was a great, great launch. We were very excited, and we're excited to keep doing this for the community. In addition to that, we've also done some things for our employees as well. We've offered through CNC Produce, we're doing a discounted produce for our employees once a month. So we don't just have people in the community, our own employees are in the community as well, but they're also our employees. And so we are offering them that. The last 2 months, we've grown significantly with that. And we are also getting donated boxes to help some of our employees that need help. So that's been very successful. We've done hygiene kits for our homeless and displaced patients. These are amazing. It lets patients that maybe came in with nothing leave with the essentials that they need to care for themselves. That's been hugely successful. We've had 30 bags go out in the last 2 months. So there is a need, and it's gone really well. And then our next big one is Narcan distribution. So we do have populations of patients that are high risk for overdose, and it doesn't just have to be someone who's a drug user. There's a lot of education out there going out that you don't know when you're going to come in contact with it, or maybe you'll be driving down the road and someone's having an emergency. Having that Narcan with instructions is a phenomenal thing to have available in the community. But specifically for our high risk patients that come into the ER or inpatient areas, they are now going to leave with a kit of emergency medications and then resources to get help. So we're really excited to launch that here in the near future.
I love that. I know when, I was first hearing about this Narcan, the initiative that we're gonna partner and be able to, distribute that, I was so excited about that. One of the things that is, I'm really passionate about is really getting out in the communities and really serving people where they are and meeting the needs of the people where they are, not expecting them to come to us all the time. Let us come to you and let us help meet your need. And that's exactly what this Narcan uh, distribution will allow us to do. Um, I, I'm excited about that. I'm excited about it. So, for both of you, what type of things do you see that's in the future plans, the immediate future, as well as 5 years or even longer down the road? What type of things do you see us doing?
You want to go first or me too?
Go ahead.
So one thing that we know is a huge need in the Northland, and I don't think this is any surprise to anyone, is public transportation. We are metropolitan, but we're not. It's big city, small town kind of feel, and that's wonderful. But it also limits some of our people in our community, not just for healthcare purposes, but just general daily life. And when we talk about health equity, we are also talking about those social determinants that keep people from being able to live a healthy life, get access to food, transportation, going to work. All of those things do end up resulting in whether they live a healthy life. And so, public transit up here, something that's affordable, a large option, we cannot wait to help start partnering with some of our community organizations and public officials to try to get some expanded transportation in the near future. It's something we've added some things to, but I would like it to see it go much bigger. And then long term, I would love to see this area get a shelter or a nonprofit organization that we can really partner with to refer patients to get additional resources. We don't have that up here in Clay County or in the Northland. We have a lot of resources outside of there in larger metropolitan areas that we're referring patients to. But to have something close to home for these patients would be really phenomenal.
Wow. Thomas?
I think, when I think of the next 5 to 10 years, I think of our employee perception of us as an employer and how can we continue to evolve that, because we know that driving people to healthcare careers is just really important, and Liberty's no exception to that. We need to continue to bring more and more to our healthcare workforce, and we can do that by reaching a diverse population of the workforce and bringing them into healthcare. And one of the things that we do, I think that we've done a nice job over the last few years, is measuring the employee sentiments on how we're doing as an employer through our employee engagement survey. There's specific questions that really tie to, do you feel like you belong here? Is this a good place for everybody? And I would love to see over the next several years that we move the needle on that. We're doing okay. We're right in line with other organizations. But at Liberty, I think we like to be better than other organizations. And so how can we get to where we're one of the best hospitals in the country for building that diverse workforce where everybody feels like they belong and they have a place?
Yeah, I think one of the things that really sets Liberty Hospital apart is that we're not a huge organization. But we're not small either. I mean, we do open heart surgery, we do brain surgery, we deliver babies, we have a level 2 intermediate nursery, we have a critical care unit. We are not small town hospital. And I think it's really important that we take that, but we feel like a community hospital, right? So it's a really unique mix that we are. We're right up there cutting edge with a community feel. And I think that the heart of our organization is for our community. And I do think that sets us apart. As we keep that heart for the community, we keep wanting to get more and more and more involved in the community and seek to improve the health of our community through a variety of ways, by training our staff to see disparity, or to see issues within health, or see issues that would prevent people from wanting to come into a hospital and meet that need, to meeting needs that they don't even know they have, by getting out there and saying, hey, did you know this? Do you know about this? And I love that there's such a concerted effort to make those things happen. Anything else about this topic that you guys would like to just say, hey, I don't want to forget to mention before I ask my favorite question of all of the podcasts that we do?
I don't think so. I'm really excited for the future. I think health equity and diversity has really been highlighted in the last few years in healthcare, but not just healthcare, across all organizations and all businesses. And I think it's so great that we're taking specific efforts to really improve this, not just for our patients, but for our employees and across the board, just making a difference. That one patient made a difference. Even if you're touching 5 patients' lives, that's 5 people's lives that were better than they were yesterday. And so I think this is such great work and so important. And what better way to partner with your community but to help them? So very excited.
And I think, to echo what Lindsay's saying, it's work. It takes effort, and to see organizations, ours included, that are putting effort towards really mindful approach to health equity and equity in our workforce, I think is just a really important thing for us to be doing. And it's really exciting to be a part of it.
So now for my favorite question of every podcast that I get to do. Before we close today, I would like to ask you to share your favorite story about your career in healthcare that really highlights the topic that we're talking about today. So, Lindsay, let's start with you.
Oh, great.
Yay.
Mine is really personal, but so we were just talking about the launch of the mobile food pantry that we did last week. And this team of mine and myself, we have put a ton of work into this, tons of time and energy. I was the lead for this team. And 2 days prior to this event happening, I had to back out because I had a personal family funeral that I needed to be at on the same day. As a team lead, I was disappointed for myself, but also for them that they were going to have to pick up the pieces. And as a leader, you hate kind of leaving your people to kind of deal with all the things. None of them felt that way. They were like, hey, we got this. You go do what you need to do. Don't worry about a thing. And they were rock stars. They ran it beautifully. There was not one glitch. It was a completely seamless, just wonderful, wonderful event. Couldn't have said enough. I had tons of people in the community reach out that it was amazing. I had other employees reach out saying it was amazing. It was also the fact that during my time of need, they were not only picking up the pieces for me at work, but they were supporting me as a person, sent beautiful flowers. They couldn't have been more supportive. But that is what I love about Liberty. We're not just team members. It's not just a job. It's not just a coworker. I mean, we're truly friends and we're truly supporting each other. And to wake up every day and go to work and do something so meaningful and so impactful to people's lives and get to hear that and hear their stories and be part of their stories, but then also have wonderful teammates that you can call friends, it's priceless. It's unmatchable. And so I think last week I had an awe moment that I am a very blessed person and I'm very blessed to be at Liberty.
Wow.
All you.
How can I top that? I was most nervous about this question, to be honest, because I'm like, I know she's going to ask it, and people have good answers to this. And I don't work in traditional healthcare, so to speak. I work in human resources, supporting the healthcare workforce, and I feel that really deep connection to healthcare for that reason. Yeah. And before I worked in a hospital, I worked in a pharmacy, and so, I consider myself connected to healthcare, but maybe not traditional healthcare either. But so how does, what's so great about healthcare, and how does that really have a connection for me? I, I had to think about this story and remember the details so I could share it with you. But when I started working for a pharmacy when I was 16 years old, and then I worked there until I came to work at Liberty about 8 years ago. Worked there for a long time. And much like Liberty, there was a lot of great mentorship and development. And so, as I was in high school and trying to figure out what I was going to do with my life afterwards, I had great people around me that helped teach me the benefits of working in healthcare. I remember working for a manager who had a similar path as me, had started working for the same company in high school and had stayed afterwards. And she was one of the youngest members of leadership in the market, and just had a really good, successful career, and had, been a pharmacy technician and kind of grown that way. And she told me one time, which I thought was kind of funny at the time and didn't really see the connection, but she said, you know what, I thought, when I thought about working for a drugstore for the rest of my life, I didn't want to sell toilet paper for the rest of my life. But I had to realize, or once I realized, that it's about so much more than selling toilet paper. We're here to meet the needs of patients, of people. And whether that's, the daily commodities that they need to pick up on their way home, or it's the prescriptions that they need to pick up after the worst day of their life and I just left the hospital, that's important work. And that always helped me feel really connected to serving patients and serving in the healthcare community. So that's what keeps me in healthcare.
Yeah. Dr. Don Berwick, one time he used to be the Surgeon General of the United States. I think it was under President Reagan's time. But he said, we have the honor of being present in unwelcome circumstances. And I have loved that quote from the time I heard that or first read it. Because that's what we do every single day. Nobody wants to be in a hospital or even connected to a hospital as a patient. But we in healthcare, regardless of if we're doing direct patient care or we're supporting those who do provide the direct patient care, we get to be present in those unwelcome circumstances. And I do truly consider that an honor. And I know, because I know you guys, that you consider it the same honor. So, what a great conversation about healthcare disparity and healthcare equity that we've been having. But unfortunately, I need to bring us to a close. Any closing thoughts or remarks that you might have?
No, this has been wonderful and learned so much from both of you.
Yeah, thank you for having us.
Yeah, I'm so glad you came. Every time I talk to you guys, I learn something more about the importance of how we treat our staff, how we train our staff, how we view the care that our patients need, how we can get back out into the community in a different way, perhaps. So thank you so much for coming and joining me here on today's podcast. So for the next podcast, I want to let you know that we are going to be able to meet some of the future of nursing. I'm really excited about this one. We have some new nurses that are coming to talk about what it's like to be on that front line of healthcare at the bedside. So until next time, thank you so much.